to talk about the pharynx. What do you guys think the pharynx is? The what? True.
Anterior to the pharynx? Or posterior to the pharynx?
What I mean is,
It says
the pharynx is like a passageway, right? It's like a corridor that leads to things. So we have, it's 5 inches in length. It's a passageway for air and food. When we breathe in, it goes down the passageway into the trachea. And it's located in front of the vertebrae, but behind our nose, our mouth, and our larynx. So it's divided into 3 parts: the nasal, oral, and laryngeal portions. And we'll get into that more in depth in the next few slides.
So as you're writing, great test question there. Where does the pharynx begin? According to what you see is there. Basically at the nose, nasal passage. Right.
Ready? Alright, so we have our first section, which is called the oral pharynx, which means what?
mouth.
Yes, exactly. So it extends from the soft palate behind our tongue, which starts at the level of the hyoid bone. And then we have our laryngeal pharynx, which is behind the larynx, and it goes down and it becomes one with the esophagus. So our roof of our mouth, when you touch it with your tongue, it's hard, correct? But when you go a little further back, we have what's called the soft palate, and that's basically where that passageway starts. When we chew food and it goes down the oral pharynx. And then further below that, we have the laryngeal pharynx. Here's a clear picture for you guys to see. We have our oral pharynx right there. Our nasal pharynx is right behind the passageway of our nose. And this is our soft palate, which is right at the very back of our throat. Goes down, becomes one with the esophagus right here. So these are the 3 parts of the pharynx: nasal pharynx, oral pharynx, and laryngeal pharynx.
What kind of slices that? So when you're looking at that diagram, as she's going through these parts of the pharynx, larynx, and so on, make sure once again you're understanding how this anatomy lies in relationship to the relationship type of directional terms we talked about. In other words, the pharynx is superior to the larynx, or the larynx is distal to the pharynx. See how I'm doing that? The esophagus is what to the trachea? It's posterior to the trachea. The trachea is anterior to the esophagus. That's what they really have been focusing a lot on when it comes to those parts, is those directional terms. How do they relate to each other in the directional terms we learned in the last chapter? There is one, I love to talk about this one. What is this thing right here? What is this for? What's that for?
It covers the esophagus. It covers the trachea when you're eating.
You were right the first time.
Correct.
Or it covers
It's
the esophagus.
it's like a little trap door, a little flap.
Yeah, but if it's not in place, you're getting choked up
When
on
you
that
swallow,
water.
it closes so you don't aspirate, you don't breathe in the food or the drink. It's like a little trap door. And you'll see whenever you get into clinic, you'll do some fluoroscopy studies that are called swallow function studies. When they do swallow function studies, they're evaluating swallowing. So what part do you think they're evaluating in particular? The epiglottis, to see if that flap's working correctly. So they'll be drinking barium, eating food with barium on it, and they're looking for that barium, if it's going to aspirate into the trachea or if it's going to go down the right hole, down the esophagus. You know, you say, oh, you have the wrong hole, but you're choking. The wrong hole is the trachea, and your epiglottis probably didn't shut correctly, or you try to breathe at the same time you're swallowing or something's going on there, but, yeah.
Is that where you get hiccups? 'Cause
Where you
it's
get
enclosed,
hiccups,
right?
hiccups come from the stomach,
Oh.
up the esophagus, yeah.
So whenever you swallow, the water is.
So there, when you swallow, if you swallow right now, it goes, bloop, then it opens back up and you breathe. You swallow, bloop, it shuts, just like that. You'll see it on the swallow function side, it's like a little flap that shuts like this.
So after you swallow, it closes. Sir.
Uh-huh.
It closes the esophagus.
It closes the trachea.
It closes the
So you
trachea,
can
right,
swallow.
sir? That's it.
Yes.
Can you go back a slide?
Are you guys writing the slides down word for word?
No.
Not word for word.
Just
Good.
Good enough to.
Maybe yourself a
Just,
little,
just
What-
the
what's that
highlighted part.
term? When you take
Every other
notes,
word.
like you're writing bullet points down basically,
Yeah.
or, it's called something, I can't remember the word.
Shorthand? Shorthand?
Wilson went over it, I forgot the name of it.
Yeah, it's a
Like-
certain kind of specialized notes. We learned about it at the conference. Cornell notes?
I
Cor-
don't think.
I can't think of the
I
word.
don't like Cornell, no.
You know?
That's what they use in high school.
It was annoying.
I
Note
like
taking,
bullet points better.
note taking Cornell notes are not popular within the crowd.
Thank you.
All right.
Once you hate it.
All right, so now we're gonna talk about the larynx. So it is a tubular structure, 1.5 inches, kind of short, and it's located right below the root of our tongue and in front of the laryngeal pharynx. So the larynx sits in front of the laryngeal pharynx.
Ma'am, what's the when you said pharynx is just a passageway.
It's a passageway.
It's not a tube. That's why you said larynx, but it's actually a tube. What's the difference between a tubular
So if we go back a slide, when you see the terminology of tube, you see how as you go from the nose to the larynx area, it becomes tube-like in shape? That's what it's referring to. The esophagus is also a tube-like shape. But if you look towards the nose, where it starts, it's not tube-like, right? It's just an open passageway. But as you move more inferior, it becomes tube-like in appearance and shape. That's what that's saying. Oh, sorry.
Oh, are we both doing it?
So I thought it was hanging up on you there. Okay.
All right, so it's located below the root of the tongue and in front of the laryngeal pharynx, and it's suspended from the hyoid bone, right below our jaw, from C4 to C6. So the larynx, when it goes further down, it joins the trachea.
So another great question as y'all are writing, guys, where does the larynx begin?
From the high.
At the level of the hyoid.
You have
No,
two
from
answers there,
fourth.
hyoid bone and at the level of C4.
C4.
So if that's where the larynx begins, where does the pharynx end? Not a trick question.
Pharynx ends at the hyoid.
Same spot, right?
Same spot. 'Cause
Okay.
there's another question in there, is what does the larynx join? Inferiorly,
Inferior.
yes. So we have our pharynx, starts with the oropharynx, or the nasopharynx, then the oropharynx, then the laryngopharynx, and then goes down into the esophagus, correct? And then we have our larynx, which is in front of the laryngopharynx, and it goes down and becomes the trachea.
Can we draw a picture for that?
I think there's a picture coming up.
Says that, ma'am,
Yeah,
it's
we
the
got some
same
diagrams.
passageway that larynx will, the same passage, at one point it's called larynx and after that it's called the trachea.
So the larynx is not the passageway. The laryngopharynx sits behind the larynx. That is the passageway. Okay? Let me show the picture again. So we have our laryngopharynx here. We go down, it becomes the esophagus. We have our larynx right there. also known as our voice box. We go down and it becomes the trachea.
So
So-
specifically, it ends where the trachea begins.
Correct. And the larynx sits in front of the what?
Voice box?
Laryngopharynx. Does that make sense?
And the
It
parts,
is a lot.
the larynx has different parts.
The larynx itself has different parts, yes.
So it's laryngopharynx to esophagus
Mm-hmm.
and larynx to trachea.
Correct.
Oh, okay.
Yeah, those people, 100,000 years ago, was making those names weren't very nice with that, were they?
They were just trying to make keyboard.
So, the larynx is guarded superiorly, which means above, and anteriorly by the epiglottis, and laterally and posteriorly by folds of mucous membrane. So, in front of and top of the larynx is the epiglottis, and then on the sides and to the back of it, we have mucous membranes. And we have a gold star question here. It serves as a trap to prevent leakage into the larynx between acts of swallowing.
You guys ever watch those videos of people's vocal cords when they're talking or singing?
Yeah.
It's pretty
Like
fascinating.
open and close.
Kind of looks like a mouth too, doesn't it?
Kind
And look, there's the lips and the mouth.
Mm-hmm.
Or is that just me?
So whenever you intubate someone, does it go through the larynx?
Say what now?
When you intubate somebody?
When you intubate somebody, yes, because you gotta
Through the
feed it
larynx.
down into the trachea. Uh-huh.
Goes down from the pharynx all the way down. And our larynx consists of our vocal cords. That's why it's called a vocal. What's it called?
Voice box.
Voice box. Yes. Same picture. I put this picture up here to better show you guys the separation. We have our epiglottis right on top. And we have our entire larynx here. So the thyroid cartilage is right in front of the larynx as well. We go further down and we have our trachea, also known as our windpipe. Same picture here. We have our larynx, we go down, we have our trachea, and behind our trachea we have our esophagus. And what's right above the esophagus?
Is that
Laryngopharynx. And what's right above that? The oropharynx. Our mouth. And then we have our nasopharynx.
is the oral pharynx and the pharynx, just the pharynx? No, pharynx has different parts.
The pharynx
Oral,
has
the
three
larynx-
parts.
oh, okay.
Nasopharynx, oropharynx, laryngopharynx.
Pharynx is the general term, but that pharynx is divided into 3 subdivisions. So you have a pharynx overall, the entire passage at the superior portion is called the pharynx, but there's 3 subdivisions, the nasopharynx, the oropharynx, and the laryngopharynx. It's divided that large area into 3 parts.
Just think of it as a long hallway down into the esophagus. And we have 3 stops. The nasal, oral, laryngeal, and then we have our esophagus.
Okay. So the esophagus is a continuation of the pharynx.
The laryngopharynx
Yes.
in particular, because you can't say it's a continuation of the oropharynx or the nasopharynx.
Because at the point of the larynx,
Laryngopharynx.
the laryngeal pharynx is the part where behind the larynx.
Correct.
And then your larynx is here, your esophagus is here. Yeah. By the way, I always find it fun to point out, you guys ever realize how large your tongue is?
It's a big old tongue.
There's a lot of tissue that you don't see in the tongue. Yeah. It really is that big too.
How long is it? Like 2 feet? 3
How
feet?
long is it? I don't.
2 feet.
2 feet.
No, they
Two.
don't.
If you're Gene
I
Simmons,
might
yes.
start.
I would be
But he had some,
Case reference, nice.
Yeah, he,
Got it.
He cut the tissue there, so.
She said that's her son's
Alright, now we're gonna go further down, or in the middle of the lungs, we have the mediastinum. And this area has the sternum right in front of it. We have the spine behind it, and we have the lungs on both sides of it. So it's the area right in the middle of the lungs. It has important structures such as the heart, the vessels that originate in the heart. We have our trachea and our esophagus, goes right in the middle of our body. We have our thymus gland, our lymphatics, different nerves, fibrous tissue, and fat. So our mediastinum has all of the structures except our lungs on both sides and the pleural cavities that the lungs sit in.
Like mediastinum, like the middle.
Middle of the thorax.
Median.
That's a part of the sternum, the xiphoid. That's the most inferior portion of the sternum.
Except the lungs and what?
The pleural cavities, or pleura. So what's in front of our mediastinum? Sternum. And posterior to it, we have our spine, and laterally to it, we have our lungs.
Good questions.
Yes, yes.
Alright. Another clear picture you guys can see, we have our heart, our vessels, we have our esophagus coming down, and of course the trachea here. And we have our spine to the posterior aspect of the mediastinum, and we have our sternum anteriorly.
Now, I want you to look once again, just think of those directional terms we've gone over. Look at all that anatomy and how they're related to each other directionally. Be thinking about that.
We could ask what's inferior to the mediastinum too.
Which one is the mediastinum?
That whole
The whole
area.
This
section.
whole area that has the heart and all the vessels,
This whole picture is the mediastinum.
excluding the spine and the sternum.
It's the area in between those 2 points.
And the trachea, right?
Trachea, because everything goes down into the midline of our body. Alright, review questions. Which lung has 3 lobes?
Right.
Hey,
Oh wow, that's quick.
Nice.
Aspirated foreign objects are more likely to lodge in the
No, the spirit objects are more likely lodged in the trachea.
Oh, so why is the answer A?
Right.
Justify your
That's a good
answer.
question.
I don't know, cause I got it wrong.
Did anyone say A?
Is it
No.
She said
Oh,
A.
why is it A?
The primary bronchus,
Yeah.
not the secondary bronchi, the primary bronchus. One is larger than the other.
So remember we said the right primary bronchus is shorter and wider and more vertical. So it's easier for things to go down that way.
So that was a great case point, guys. See how quickly you guys said esophagus? Because you saw the word foreign object being lodged. Look at our key words again. We gotta know what aspiration means as well. Now I know we haven't really talked about that much. I mentioned it briefly earlier. But aspiration means what?
breathing?
We breathe in something we should not be breathing in, something besides air. We're aspirating it into our airway. So right there, now that I know what aspiration means, I can eliminate at least one of those answers, right? Because esophagus, we're not breathing through the esophagus,
No,
right?
exactly, it should be the trachea.
So you can knock that out. So we got 3 other answers that have to do with breathing, and we can narrow that down further. Which one is the biggest of those primary bronchus? That right primary bronchus. Therefore, that's the easiest one to aspirate foreign bodies into. Carina is just what? What's the carina again?
It's the point where
Bifurcation.
bifurcation.
That's all it is. It's just a split off point. So we can eliminate that as well. Always be thinking how you can eliminate answers. It's going to help you with those type of questions.
Okay. And we just answered this question.
B.
Level of the
Speaking of
tracheal
which.
lubrication is B. Which structure is located in front of the vertebrae and behind the nose and mouth?
C.
Behind the nose and the mouth.
So it's behind the pharynx, behind the larynx, nose.
C.
Is it, it's the larynx, and behind the pharynx,
I don't know, I just see nose.
behind the nose.
Keywords, nose and mouth.
Nose.
So what's
Nose and
behind
mouth.
the nose
Is
and
the
the mouth?
pharynx,
It's
is the,
D.
It's,
You right?
is the pharynx.
That's the
oh, the
pharynx.
pharynx. Oh, I thought it was.
Because it's nose and the mouth, that's fine.
The pharynx
If
is
it was
above.
only the nose, it would be the pharynx. If it was the mouth, it would be the larynx.
Correct.
How about those keywords, guys?
Oh, I
Keyword,
see.
nose and mouth. Nose and mouth have to do with the pharynx.
So it can't be thyroid cartilage because it's right here in front of our,
Larynx.
yes. And then it can't be carina because it's all the way in your, leading to your lungs. And can't be C because it's also right in front. So it has to be D. Does that make sense? All right. So we have a picture here of a patient that drank barium through the esophagus. And it leads to the stomach. What position is this patient in?
RAO posterior.
Specifics.
Or the right is showing, oh, it's showing the right, so it's in the anterior position, sir. It's because when we're
This is a
facing,
great question she just asked, Jill.
because there's a marker showing
Is it
right.
RAO?
Oh, the right is also,
Yes.
You are correct. So see, the marker is
Right.
posteriorly, which means the patient in which position? PA, correct?
oh,
So that
I
means
see.
the patient is facing the IR, and then we see the left side is elongated, which means what?
The lung is bigger, the lobe, the bigger lobe.
Which means it's away from the IR.
Oh,
And we're gonna review all that as well.
oh, I see.
But that's a great point. When it comes to those obliques, you're gonna have to identify those. You're always marking the side that's touching the IR. Whether you're doing your posterior obliques or your anterior obliques. That's one of your first clues. And then which lung's being elongated. And we'll review that as we move forward. But
So
these
that-
next few slides, all this anatomy we've just looked at on diagrams, we're about to start applying to actual x-rays. So I want you to pay close attention here because this is gonna be the majority of what you're gonna see on your image review exam with the hot spots. So pay close
So
attention.
I
We're
have a
gonna come back to
question to
this
you.
though.
The R is showing opposite, that's why we think that it is posterior.
That's actually irrelevant. I mean, because not every tech's gonna follow that principle. Basically,
could have been-
you're gonna be able to
could have
identify
been-
the position by which side's marked and which side of the lung is elongated. But we're jumping ahead, we're gonna come back to that in the positioning. So focus on the anatomy for now. We're gonna come back to positioning later. Yeah.
Would it have been okay to look at the esophagus and where the stomach is like kind of going, to kind of been a clue or been an additional clue to help you figure out what
Could
you're
be.
looking at?
Yes.
Because like the stomach is obviously going to the
But
left.
I want y'all, Miss
Patient's
Bonilla, I
lung.
want you to just point some random lung anatomy. Let's see what they remember on that radiograph. This is what you have to do for your next test.
Should I do this one or?
The hot
Well,
spot?
let's do the next one. We'll come back to obliques.
Hot
That's
spots?
This
com-
one's
those
got
are-
them confused.
Those are complicated, yes.
This one's easy.
This, we got some stuff labeled for you already. Now, your radiographs are not gonna have pretty lines on it like this. This is to show you an idea when you're studying. Draw yourself color-coded diagrams like this. It can help you identify that anatomy easier.
Mhm. So we have our trachea coming down the middle, leading to our right and left primary bronchus. We have our carina right in the middle, which is the junction where it bifurcates. And what is this area right here? Specifically,
The left
Left.
costophrynium.
By the side,
yes,
yes.
Mr. Donahue is going to knock that into your head. Specific. What about this area?
Side face.
Oh, I'm glad you said that.
Tertiary.
That's a common mistake.
With the right
tertiary
diaphragm?
bronchus.
Wait, what did you say?
I said diaphragm, but then, what is it, right diaphragm? Or the base?
The base.
There you go.
Right base.
Or
Or
right
base of the right lung.
So make note, on a radiograph of the chest, when we're pointing to this area right here, that's always gonna be the base of your lung for a radiograph. The diaphragm, even though it's located here, is invisible on the radiograph. You cannot see it. So that's a common mistake. I'm glad you said that.
On a radiograph is an X-ray, sir.
Yes.
So on the registry, if they're like,
They're-
at the bottom, just.
They're at the bottom, it's gonna be the base.
The race.
But be careful because the corners are, once again, what?
Cluster
Clustering angles.
We have our angles at the corner, we have our base. What about these?
Apices.
Apices. Right?
Note that big shape in the middle, it's kinda,
Our heart.
so I'm glad y'all said that as well. So, a little difference between a diagram and a radiograph once again. On a diagram, yes, it's the heart, but on an X-ray, we're gonna call it the heart shadow. Specifically, the heart shadow. And one that we did not review in anatomy, if you'll go to the top of the heart, that's one that we always label, the little notch.
Cardiac.
Not the cardiac notch, the aortic notch.
Aortic notch, or sometimes called the aortic bulb.
So is this a height prosthetic patient?
This is probably just a normal sthenic patient.
And it-
Some hints, how you can help yourself, guys. This is a great tactic. If you're visual, print out these X-rays and color code them to help you remember that anatomy.
So we have our trachea coming down to the carina. We have our left and right primary bronchus. We have our heart shadow here in red, which is in what area of the thorax? Mediastinum. Yep. We have both of our lungs highlighted in green. And we have our clavicles here. And you can even see the scapula on the sides. But you don't need to worry about that just yet.
That's next semester.
Is the prof of ology or whatever on the last slide?
Oh.
Is that a like YouTube channel that we can follow where they show us and
Mr. Donahue.
illustrate X-rays and whatnot?
One second. Like,
I'm
is it gonna
assuming.
do with a bunch of words?
There's so many sources out
You're just gonna have a
there.
I
plain
went on
X-ray,
YouTube the other day
it'll say,
before I
place a
tested,
marker
and
on
I
the
just
right
went to sleep listening to
apex of
YouTube.
the lung.
Oh, really?
I'll put your little dot on that.
Maybe you should share that
There's
link.
no law. There's a range that you have to put in to get it correct. Another question? Here?
Oh, I was gonna ask if this is like a YouTube channel they can, look at.
Yeah, it should be. I mean, there's a million good things on YouTube, guys, for learning this stuff. Like, there's anything you can find. Just be careful, make sure it matches with our curriculum. Because some people get on there and profess to be experts, and they're making junk up. Like, oh, that's the pharynx of the right lung there. The orangiopharynx down here in the corner. Make sure they know what they're talking about. That sounds funny, but you'd be surprised what some of these people put on these YouTube channels, so.
Yeah, you don't need to just study your textbook, there's millions of other sources out there that can help you study anatomy.
So there could be mistakes in these videos that are posted in the YouTube.
There can be lots of mistakes, yes.
Really?
So make sure you cross-reference with your textbook. That's not to scare you.
There's a lot
They will
going
all
on
be
here.
found in there.
Do you wanna take this one?
This is just more a visualization, guys, of all the anatomy found in a single chest X-ray that a radiologist is gonna look at. Now, I want you to focus on what we've talked about so far, but a lot of these texts, these words you see here, we're gonna fill in as we go through subsequent chapters, because all the anatomy is gonna start overlapping with each other. Like when we get to upper extremities, we'll start talking about the parts of the clavicle. We'll talk about the parts of the spine. We'll be talking about parts of the heart, things like that. So we'll talk about what's an anterior rib versus posterior rib. That's just kind of like a preview of things to come. For now, what anatomy we've told you about is what you need to focus on. And we'll have more practice moving forward here to show what we're talking about. So it's not to scare you, just to show you what's to come. That's good.
Wait, can you go back? How do you pronounce that middle part? The AZYGO.
It's a zygo,
The what?
the one right here. A zygo.
Oh, a zygoesophageal line, that is a line that's basically showing the overlap of the heart and the esophagus. But you don't have to worry about that one. That's for a radiologist. Pediatric chest there.
How did you notice that pediatric chest?
Small. Look at the shape of the lungs, I'm sorry, shape of the ribs, and look at how the ribs are not connected to the spine. What's present there? What did we learn about last
Cartilage.
chapter?
Wow. Oh, the
Epiphyseal
epiphyseal
plates, right? The growth plates, they haven't fused yet. Correct. So this is a very old radiograph, actually. That's a film. Very bad quality. But we can still name some anatomy. What anatomy can we name on that radiograph? Just point to some stuff. What's that top of that lung there called?
ABC.
Which one?
That is the left lung.
The left apex, or the apex of the left lung.
Which exactly is the apex of the left lung? Huh?
The most superior portion. Curves
With the
at top.
first rib, you would probably point that, huh?
Yes. It's usually above the clavicles on an X-ray.
And you don't have to worry about the ribs yet. The only thing you need to know about ribs right now is how many ribs we need to see on a radiograph, which we're going to get to later today. For now, we're focused on airway and lung anatomy, and heart, of course, as well. What's that down there? That's a whisper. You can say loud. The right
I can say
angle.
this stuff.
Right costophrenic angle. We have our left costophrenic right there.
So you'll notice
Is that an A down there?
it is.
Where?
For
It's just
what?
for a diagram.
Oh,
Label
okay.
diagram. So what can we not see on that radiograph? We can't see the trachea, right?
Yeah.
So keep in mind, we can't always see the trachea on a radiograph. What is that indicative of? Why wouldn't we be able to see the trachea in that radiograph? What do you think?
The
Motion.
neck.
Magnification.
How do we see the lungs? What do you think's making those lungs black?
Not
Oh,
enough
the
Air.
air in it.
Not
the-
enough
Air. So if we can't see the trachea, that means what?
Oh, it doesn't have air in it.
There's no air in there. Right,
Awesome.
right.
So they took the picture when, or they took the radiograph whenever the.
Well, this is a
patient-
baby, so
Baby.
let me ask you a question, Jay. When you go up to a baby and say, hold your breath, what are they gonna do?
Cry.
Just probably cry in your face, right? So that's a great question as well, because I can't tell a 1-month-old to taking a deep breath, blow it out, taking another deep breath and hold it. What are they doing? How would you take a good X-ray on a baby?
You see
Yes, exactly.
You wait for that big mad pause. If you ever seen a baby cry, they get so frustrated they go.
In and out.
So when do you take the picture?
When they breathe.
When they lift that chest up, right. If they're just going really fast, you just gotta time it as that chest expands. So that's one of the challenges of pediatrics there, but
Get on the rotor.
yeah, get on the rotor.
So it would be poor practice to like hit them with a little water gun. So they take that like
I,
rubber
you
shot.
know, you say that, and I've told so many parents, like they would come to me with their baby for a chest X-ray. Like, I'm so sorry, I can't get her to stop crying. I'm like, Mom, it's okay. That actually helps me. I need her to cry. Why? Because if they're not crying, I'm not going to get inflated lungs. If they're just all chill laying there, first off, there's probably something wrong because they should be crying. Because when a baby's held down, they usually don't like that. If they're not crying, usually that's indicative of something going on. But we want them to cry so we can get those inflated lungs. Because if you send an X-ray to that doctor with uninflated lungs, he's gonna call you in there and make you feel about this small and make you repeat that X-ray. Don't ever send a doctor uninflated lungs unless you can justify why. Anyway, we'll talk more about that. Let's stick on anatomy here. I'm going off on a tangent here.
We digress. Oops.
Good lateral view there. Look at all that stuff we can name. So that one's labeled for you, but that's just an example of all the things that we can label on a lateral chest. So when it comes to apices, I want y'all to pay close attention. Now on the PA or AP chest, we can indicate sides, right? For a lateral, they're superimposed. Therefore, it would just be lung apices, plural, or superimposed lung apices. Same concept for costophrenic angles, superimposed costophrenic angles, superimposed base of the lungs. Now that says diaphragm there, that's just showing that's where the diaphragm is, but remember, when it comes to us labeling x-rays, we're actually gonna label that at the base. That's the superimposed base of the lungs. Now, one thing I also want to point out here, guys, on anatomy, even though we're not specifically labeling ribs, when we label ribs on a lateral radiograph like this, you see how they curve slightly on the back there? That's going to be very important for positioning because we want those to be superimposed to show that we have a true lateral. But if I'm asking you to label those ribs, you don't have to put the number, you simply just say the posterior ribs. Or if I say posterior ribs, you can point to any of those posterior ribs and get that right. Now, same thing for the vertebrae. You'll see the vertebrae, they look like little squares. Those are simply just called thoracic vertebrae for now. 2 semesters from now, we'll learn how to label those by number, but for now, they're just the thoracic vertebrae. All right, is that making sense?
No, but not to me, sir. I didn't understand. Sir, are you seeing because the one portion of the rib is behind and you cannot see?
Correct. So the posterior ribs are unique to being right here behind the spine, and they just slightly curve. And we'll have more radiographs to show you what we're talking about, but these are specifically just going to be called the posterior ribs for now. That's all you got to know. They do have numbers to them, but for now, we're just calling them posterior ribs.
Thanks.
The shadows, like, on the lungs is the superimposition of the lungs, so like, you can see one and the other
Yes.
at the bottom, okay.
Mhm.
Yes, because one lung is what?
Like shorter, wider, bigger, whatever.
Right. Ah, now what is this? You guys have done this in the lab.
Flexion.
Airway or upper airway?
That's your upper airway.
Yeah.
AP in your lateral view. So
What's
what can
that?
we label on that? We got some good stuff to label on
That's
this.
a trachea.
That's a trachea.
Mhm. But what's in the trachea?
Or the air, the
Correct.
that's down.
Air.
So what she just brought up, when it comes to labeling the trachea on a radiograph, once again, a little bit different terminology. We're gonna refer to that as the air-filled trachea. Specifically, not just the trachea, but the air-filled trachea. Why? To have air in it.
And what's that?
Which one?
C1.
C1, correct.
Which one see them?
First cervical vertebrae.
And then
What?
axis or whatever is sitting on top of that, right?
That's the axis. The atlas is no. That's the atlas. The first one.
Okay.
Mhm.
And the second one is the axis?
Mhm.
Okay.
Is that the hyoid?
Yes, it is.
Yes, it is. Right there.
Then
Looks
the,
out of place.
Let me ask y'all
Love
this.
C4, man.
What is this?
Epiglottis.
yeah.
The F-
Y'all see it?
Mhm.
Yeah.
It's like a little spike.
Oh, yeah.
So, like a loop, 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 like a little flap, just like that. If you're watching this on a fluoro machine where it's a live x-ray, that's your epiglottis. So, if that's the epiglottis, what is this?
On top of the
What
glottis.
is this right here
Glottis.
that we talked
maybe.
about?
The larynx.
Larynx.
The larynx.
So when
No,
we
that's
say
the-
LP for anything, there's always the
This
on top of
oropharynx?
something.
It's here, right here.
SFP.
Oral?
Remember nasopharynx?
Laryngopharynx.
So, nasopharynx,
Maybe.
oropharynx, laryngopharynx. Those 3 divisions we just talked about, right there. So when you're labeling that, the area behind the mouth, oropharynx, the area up in the nose, nasopharynx. Down here, basically where the jaw is, see the corner of the jaw here? That's your laryngopharynx. And then basically, when it comes to the larynx, this area right here by the epiglottis and the hyoid bone is your larynx. And then your air-filled trachea down here. If I'm asking you to label the air-filled trachea, I want you to put your marker down here. That's very important because trachea is here, larynx is here. Y'all see that? It's almost like there's a little line divided there. You see it?
Okay. Yeah, that makes sense where it divides us. So the larynx and then the trachea.
So on the right picture on that AP, we can't really see those divisions, right? This looks like one singular tube. Therefore, that whole structure we see in the middle of the spine will just be our air-filled trachea.
So what's that line between the larynx and the trachea?
This right here,
Yeah, what's that line?
what is that line? That's a good question.
no air in that. Is a bone or
I'm
something?
not exactly sure. It's not a bone. I'm not exactly sure what that is. In fact, you're not always going to see that on every radiograph, but
But
I'll have
and
to-
the
I'll have
and
to check and see
thank
what
you,
that
sir.
is.
And the larynx is also gray, so it also has the air right there. Nicely because it's coming down from there, sir.
because remember that becomes your trachea as that air travels.
From the larynx to
Direction.
the
What else can you label on this, guys? What's this?
Your left.
the
Left apex,
the right.
the right apex. Air-filled trachea, C vertebrae.
What's
Any
that?
sense?
C vertebrae. C first vertebrae.
C vertebrae.
First rib, correct. See that, how it curves down?
That's a
Quiz
good one.
me.
Can label
Just
a lot of
quiz him,
stuff
not
on
me,
there.
okay? Quiz Mr. Donahue.
What now?
Just quiz me.
Oh, quiz me? All right then, quiz away.
Where do you have your base?
Where's the base?
The base.
Bases, right here. I'm gonna point out everything y'all need to know on this radiograph for your test, okay? So let's start with the corners. Yeah. Because you need to start looking at these chest radiographs very closely. The two corners, those are your costophrenic angles, your left costophrenic angle, your right costophrenic angle. The flat portion on the bottom,
The base of
that's
the
your bases of your lungs. This bulbous gray shape here is our heart shadow. The tops of the lungs, we have the left apex, the right apex. In the middle, if there's air present, that will be our what again? Air-filled trachea.
Very filthy.
The area of bifurcation, if we can see it, would be what?
Bronchus.
The
Bronchi.
carina is the bifurcation area. Now, we can't always see that, but if there's air there and we can see it, that is the carina, where that bifurcates. Now, there's one piece of anatomy we have not named, well, two here. Well, we did name that little notch there, the little top portion of the lung, guys. Now, that does differ between patients. Sometimes it's very, very prevalent. Other times you can barely see it, but that is our cardiac, I said it wrong again. Aortic notch or aortic bulb, right there. Now, one piece of anatomy we did not name that's very important to know on the lungs. You'll see that it looks like it has little branches in there. Now, we know on the diagrams that those were called the bronchi, right? Like your secondary and tertiary bronchi. Once again, a little bit of terminology change on an x-ray. On an x-ray, when we're looking at the branchy areas, and it's found on the left and right side, that's what we call the hilar region. Hilar region, H-I-L-A-R, hilar region. Y'all see the little branches? That's what we're talking about. That is the main anatomy you know on that chest radiograph right there.
So these are branches of
The branches are the hilar region.
the branches of what, sir?
They are the secondary and tertiary bronchi.
So hilar is spelled H-Y.
H-I-L-A-R. H-I-L-A-R. Now there's a lot more anatomy on that radiograph, but that's the ones to focus on this particular one so far. Does that make sense to everybody? So same thing, we semi went over this. She's just gonna point to some random anatomy. I want you all to tell us what we're pointing at. It's a lateral chest.
Sternum.
Sternum.
And
Specifically T vertebrae.
Posterior ribs.
posterior ribs, yep.
Why posterior rib now? Because that and
Posterior side,
oh, I see. It's different. Yes, ma'am.
yes, so they're not anterior, cause that would be in the front. So behind the spine would be posterior. And this,
Is that
costophrenic angles,
costophrenic?
costophrenic,
Costophrenic.
and we have our base, our apex or apices. And, what about these little markings? Hilar region.
Hilar region, y'all see it on the lateral too? Those little
And
branches.
This light gray shadow,
Heart.
heart shadow, yep.
I want to ask y'all something, because we're going to talk about this a little bit. What are these weird little lines here? It's my
Yeah.
sports bra.
Artifact.
The elastic
You can
bands
see
that
it
show
here
up.
too.
Oh, true. Does this patient have that lordosis issue? Why is there?
No, it's just understanding.
Okay, just
What
possible.
makes you think that?
They're
It's
back.
fine.
Yeah, and then the I forget what it's called. OID. Depending on like how that it's based on the backside basically. That's
Oh,
what I was
over
looking
here?
at. Yeah. So if they're like leaning back and then they walk their legs up to take that picture or whatever the case may be.
They were likely holding a bar above their head
But, okay.
by the way the arms look like they're so high. And they're probably just kind of just hanging kind of a little bit diagonal. That's why they're shaped like that. That's, I don't know 100%, but that's my assumption.
So the artifact is not really bothering them. right?
No, you would not. So we're going to talk about this. You would not want to send radiograph with those artifacts in there. Depending on your doctor, some doctors do not care, but the majority I worked with would chew me out for that. That's why you got to tell your patient to take their bras off, even if it's a sports bra, because elastic will show up, especially on digital X-rays these days, because they're such high quality.
Even if it does not interfere with the anatomy of our.
It's going to, because a bra is in what area? The area of the lungs.
Yeah. It's gonna go all the way around the patient.
That's what-
Especially if you're working with pediatrics, you don't want to keep repeating x-rays.
Good time for a break.
Oh, okay.
All right, take 10 minutes, guys. We will start right back at 9:20. Go over some pathology.